Okay, right. Well, thank you for staying with us. Having spoken about our work on suicide prevention, I'm joined now by my colleague Imogen, uh, and we're going to talk about the project we've been working on, I think, from the beginning of this year, which is to looking at developing. The end goal is to develop a local veteran service, but we thought we'd explain why we've approached it in this way today. And the main reason for that is um, primarily because we know there are many local veterans associations. We know that Northeast Lincolnshire is very proud of its veterans, and we have the honour of having the Veterans Day at Cleethorpes every year, which is something that I know the armed forces as a whole, at every level, value and quite rightly the people in the area are very proud of. And this has led to lots of uh, services, stakeholders, interested parties uh, who work with veterans, supporting them. Um, and we've have worked with veterans, and we've developed some very good uh, links with veterans who have we've spoken to whilst thinking about developing this project, which um, we decided to start with by interviewing veterans and asking them about their the extent of the difficulties, not just mental health. NAViGO is also a social care organisation. We are very keen to recognise that the provision we have is a holistic one. So mental health may be our bread and butter, but it is very important that we also ensure that you know other aspects of life which affect veterans, and I'll come on to some of these in a while, that these are aspects that we are also able to not just be aware of, but combat, because their impact on somebody's mental health is going to be significant. And our work with veterans to date, and which is quite extensive, has shown us this. And I think we wanted something which was going to facilitate the treatment we provide, but working alongside our local stakeholders and the people who are really passionate about veterans' health in general. So to do this, we have to undertake interviews with our veterans. We need to be able to find out where they all are. We have a rough idea, and I must say I was very surprised when I was told that we have over 20,000 veterans in the Northeast East Lincolnshire area. Now, that was surprising, given the population is about 160,000. Um, that's 1 in 8 people. And but I do know that when it comes to health problems, about 2,000 veterans locally. I think that's correct, isn't it, Imogen? It's about 2,000.
Yeah, roughly.
2,000, yeah, 2,000 veterans have healthcare needs. What those needs are, given that having searched through and spoken with our colleagues in primary care, some of the GPs, our colleagues at the hospital, at the Diana Princess of Wales, and also within NAViGO, we can't find 2,000 cases. So it looks like it seems people are coming into services and going out of services, and some are not even coming into services, which is very worrying. So what we wanted to do was be able to speak with some of our veterans service users and ask them about the kinds of difficulties they've had, ask them how best to go about developing uh, a service that would be able to impact on the problems that they hear about from fellow veterans, the problems they themselves have gone through, their families, their children. And that was where we started. And we came up with an idea to apply for the grant, which is one that is offered by NAViGO to innovative projects every year. And there's usually about half a dozen projects on the membership, which is roughly 50% out staff, 50% service users and carers and local people who are interested in what NAViGO does and are members, and they all vote for these. And we, I think, quite proudly be able to say that we got, I think, more votes than all the others put together. It was quite lovely to see, and I think that doesn't really rely on ourselves, our work. It was very much the impact of the veterans in our service who kindly gave their time and helped us develop this, and also were there at last year's AGM explaining to people why this was important. And I think that was really why we were awarded the large grant, and that allowed us to say, right, well, we're going to do a bit of interviewing, some research, and we're going to look at these areas of need, and we're going to cover this wholesale. So we are going to interview veterans with a significant other, might be their partner, next of kin, a friend, and we're going to ask them about where they're living, the accommodation they have, any issues with that. These are all the components that affect mental health. So their access to food, can they buy food? Are they struggling with looking after their home, their own self-care, having things to do during the day, their physical health, any symptoms of mental health that would be severe mental health symptoms, any information that they lack in terms of a condition or their treatment for it, any psychological worries, any safety problems for themselves or other people in their network, use of alcohol, use of drugs, feeling isolated, feeling alone, not having company, their relationships, their sexual expression, any issues around that, which is, again, these are all vital components. Their issues around, any issues around childcare, education, even contact, communication, having the telephone and internet, transport, having access to money, benefits. All of these are there's 22 different reasons, and every one of them can lead to mental health difficulties, and it can lead to great problems for an individual. So by accessing all of that, some of the audience may be thinking, well, that's a lot of information you're collecting. And the reason we're collecting it is because, let's say somebody has problems with childcare. This would be something that we would want to link up with local stakeholders and people who work in childcare and look at whether we can develop something. We would look at the impact, the need. Again, with something, let's go to the sexual expression, which again, this is something that is fundamental to a healthy lifestyle. And if there is a need for psychosexual therapy, couple counseling, sexual dysfunction work, that can all be looked at in terms of the plan that we will want to put together. So those were the areas we're going to cover, and we've not just, we have to have ethical approval for this, and I'm proud to say that Imogen's hard work, we got ethical approval, was it last week?
Last week, yeah, last week.
I think it took 6 months with COVID, but
Yeah.
we've got to the point where the Westminster Research Ethics Committee has approved what we are doing, which means they see it as something that's not just ethical, but also something that is important to do and has value. So that's well done. That's an excellent piece of work there, Imogen. But besides that, you've been doing an audit of the veterans who have accessed our services. And this is a very detailed audit. I remember I was quite shocked because I think there's I think it's over 130, I think it's 135 veterans.
Yeah.
And you've analysed 45, and I was saying, well, how come you've only analysed 45? And then you told me each one takes about half a day. So this isn't just checking what's there. This is really going into a lot of detail. This is making sure we're not missing anything that might be covered in those 22 factors. And if it's not in there, we will include it. But the measure we're using, it's called the Camberwell Assessment of Need. It's seen as a gold standard measure. So they have gone through these kinds of audit processes to develop these 22 areas. So if you find a 23rd one, I think they'll be quite upset, but let's see if we do. So you've analysed 45 of these, and what you're looking at is what kinds of services people have accessed and the kinds of difficulties that they have had. Now, at the same time, we are looking at literature reviews of what exists. Remember when I was talking about suicide prevention earlier, one of the things that we were very keen to do was looking at what good practice exists. Now, good practice isn't just about good ideas. You know, this is the thing. I used the analogy of medication in the earlier webinar, and I mentioned how we would never take a medication that hasn't been licensed and prescribed by a professional, because that shows it's gone through the licensing process and has evidence. And it's the same thing here. Good ideas are fine and people will like them and may not like them. So when they like them, we say, well, that's a good idea, let's go with that. When, as a clinician and a responsible clinicians, what we would like to do is say, well, let's have a look at the literature. What actually exists that has that evidence, that gold standard evidence that tells us that if you do this, that it will work in every single case. That's what an evidence base is about. So I know you're doing a literature review looking at the needs of veterans and gaps in the research and areas where veterans' needs have not been analysed or met. So that's something we'll be looking to publish hopefully before the end of the year. We also found that we have some interesting information on the audit that you've been doing, which I know you're continually doing, Imogen. I remember we found that we have quite an older adult population of veterans in Northeast Lincolnshire. I think about a third were 80 years or older. So,
Yeah.
which I suppose people still retire to Cleethorpes is what we're finding. But why would you want to retire to Cleethorpes if every year they have that wonderful veterans celebration? Yeah, it's obviously going to be a wonderful thing for people to see. And we then found that the rest is quite a scattering. So we have quite a few below 30, about 1 in 5, and then another 1 in 5 between 40 and 60. And then the last, we have quite a few who are, I think, roughly about almost, I think it's a quarter that are between 60 and 80. So about half of all our veterans are over 60 years old locally, which has implications for our older people's services and their functional team, their team who work with dementia, work with any sort of cognitive impairments and functional problems, as I've mentioned. So we've also looked at, and we found that the vast majority do go through our memory service, and quite a few access our open mind service, which is in the town centre. But we're looking at, as I said, a wider understanding of need. And as an example, you know, I remember when I've, you know, several years ago working with a veteran and who had done several tours and had, you know, survived quite a few problems, war trauma, but also injury leading to memory difficulties. This is a young man with a family and children, ended and had a prosthetic limb fitted and had pain issues because of this. Also, you know, the impact on the family, on the partner, on the children. You know, the children were developing psychological difficulties, and coming to see myself at NAViGO for psychological therapy, I was aware that there were areas that I could influence by speaking with the child and adolescent team, speaking with the partner, speaking with the armed services, the people working on the prosthetic limb surgery, and we were able to do a lot of this work. And a part of the reasons for looking at all these areas of need was to say we have to have, the dream is to do this research, have a lot of veterans telling us about these different areas and what their needs are in them, and then say we want to develop a service that is a hub that works alongside our interested colleagues and partners in Northeast Lincolnshire. And Imogen, I know you've been to the Knoll, where which has been it's one of the I think central points for a lot of veterans locally. Can you just tell us a little bit about that, please?
So it basically acts as a bit of a signposting service for veterans, so they can come, they can have a coffee, just have a chat with other veterans. They can also discuss any difficulties with people, the people that are there, and they will get signposted to the correct organisations that can best suit their needs. They have links with legal services, housing services, mental health services, things like that, and basically just kind of get pointed in the right direction and just have a bit of a support network around them as well.
Absolutely, and this is exactly what we're looking at. We're looking at being a hub, and the Knoll is a fantastic resource, and we know it's really gratifying that they have recognized that what we're trying to do is not take over. We are not going to try and reinvent something that's working so well, but we have resources, so it would be so much more helpful than the Knoll going through, if somebody has mental health needs, for example, knowing how to fast track that person, how to have, we have meetings with other providers in, for example, as an area with housing, so with the homelessness unit, with drug and alcohol, with benefits advice, with legal advice. So what we'd be looking at is saying, okay, let's meet up once a week. And they will say, well, so-and-so's come along, we've got a veteran with mental health difficulties, what should we do? And we would be able to make sure they get the correct advice, the correct treatment, and they are not lost to follow up. They are not someone who, is not going to come along because they have multiple difficulties. And because they have multiple difficulties, we don't have a central hub at the Knoll with ourselves who are not aware of all of those, so that we are making sure that we're linking in with people who can help them with many of those issues. So that was one of the primary components of what we wanted to do. And the Knoll has even said, if you want to come and interview veterans at our base, then please come along. We have rooms. So clearly we're doing the right thing, that people who are much more aware of veterans' day-to-day difficulties, not just their mental health difficulties or their social care difficulties that we are aware of, that they are recognizing the value of what we're doing. And what I'd like to talk about before, just at the end, is give you an idea of when we are hoping to provide some information of what this service may look like. So we'll be looking into starting these interviews now that we have ethical approval, and around early spring next year, we will have enough knowledge. Remember what I said about an evidence base? It's so important to look at what is happening locally, not just look at what may be happening nationally. We want the picture for our area. It may be different. And a very good example is at the moment with COVID-19 incidence rates in Northeast Lincolnshire. Thankfully, they are not like some of the areas that are in lockdown, but that is why a local picture is so important. And for this very complex and multifaceted need that veterans have, it is so important to do this work. We have some of this information coming through. From that, we will be able to build a picture and an operational process saying, what do we do about each of these areas of need? How do we ensure that it is quality controlled, that the veteran is able to impact on what is going on, is able to feedback if things don't go well, and we are measuring that they are getting the service they desire and require. And if we can do that, we should hopefully be able to develop something for veterans that is embedded with all our local interested parties and stakeholders, but also something that allows us to really move veterans' health and mental health needs forward significantly. Thank you very much.